Because of the generous support of the MDS Foundation, the Greater Roslindale Medical and Dental Center was able to allocate resources in order to improve and work on this quality improvement project of medical-dental integration at the health center. Specifically, what it's looking at is working with vulnerable populations, which are children and pregnant women. All too frequently, we would have children come in for emergency visits and find out that they are presenting for their annual physicals on the medical side, but unfortunately they are not seeking the routine dental care. And so what we wanted to do was to really target these children when they present for their physical, to make sure it's an integrated part of the physical, that they ask about oral health, and most importantly, get them an appointment with the dentist. The grant also focused on pregnant women, which is another vulnerable population. There is a misconception among many of these patients that during pregnancy they should not be seeking oral care, that the dentist is something that they don't need to address during pregnancy. Here is where it's really important for us as dentists to educate these patients that they are in fact a higher risk for caries, talking about gingivitis during pregnancy, talking about all these really important subjects and educating these patients and actually getting them back for the care they need. And to take it even a step farther, the thought is once these mothers have the children, that these children will be brought back as patients to the health center as well, continuing the cycle of making sure that these populations are getting the oral health care that they need. As part of the grant, the dentists at Greater Roslindale Medical and Dental Center were able to do these sort of integrative events where we would present to the doctors and really focus on what to look for and stress the importance of oral health. A lot of them were completely unaware that almost all of their patients, or a good majority of them, were falling under high risk in terms of developing dental decay and having tooth problems. And I think it was very eye-opening for them that not just the 5 or the 6 or the 7-year-old needs to see the dentist, but as early as age 1, 2, and 3, these children also are at risk. It really brought them in cue on what to look for, and I think it really motivated them a lot to make a few questions about oral health a part of their routine visits.